My name is Ellie Davis. I'm the Service Manager for Adults here at ICS. Before I came here, I've got 20 plus years in health and social care now, and my background is slightly different to my colleagues in that I've worked in advocacy back when it became a statutory function. I've set up IMCA services in 7 local authorities and worked in secure services as well. And here at ICS I support the projects. I ensure that the doctors, nurses and social workers who work with us and are able to fulfil their function, and I've built relationships with our clients at the local authorities to ensure that everything runs smoothly for them too. As Service Manager for Adults, I work closely with the Head of Service, and the services that we offer have grown considerably in the last 4 years. Initially we were working with local authorities to resolve backlogs around deprivation of liberty safeguards, and that still goes on. However, since then we've branched out into other areas where we can support local authorities, and they include things like looking at Section 117 aftercare, around Care Act reviews to ensure that they're compliant. And we say to people, if in doubt, just have that conversation with us. I'm sure we can assist you in some way.
I'm Christine Warner. I'm the Head of Adult Services here at ICS. Prior to my arrival here, I did 32 years in local authority, covering all of the health and social care services. During that period, I'd gained an awful lot of experience, an awful lot of knowledge in various settings, and I wanted to bring some of that knowledge and some of that experience to adult services here, into my role here at ICS, and that was around quality, experience and knowledge and skills. I think what differentiates ICS from other providers is around the quality of the work that we actually provide to local authorities, and I don't think we are the cheapest out there in the market. However, I do think we are the best value, and I don't think you could ever put a price on quality. And I think the reputation that we have built up over time will actually clarify how good we are in what we do.
Hi, I'm Simon. I'm the Head of Consultancy for ICS Assessments. I've been working in the past decade in public sector health and social care. I've worked in NHS trusts and local authorities looking at demand management, workforce development, cost improvement, all sorts of different financial, leadership and management turnaround projects. My role in ICS Assessments is to add value to our outsourced services offer. So if we're offering a capacity and resource benefit to local authorities, looking at their social care assessments, their DOLS processes, their children's safeguarding processes, and adding that capacity to get that throughput and that volume of work, then I'm on hand and my team is on hand to look at those internal processes and behaviours. So our consultancy service brings together the best of both worlds. So we've got a huge amount of experience from 200 plus practitioners within the organisation that we use on a daily basis to deliver our outsourced arm. But what we also have in addition to that is myself and my team being able to go in and talk at that senior management level about the root cause issues. So if there's anything around the process and the system challenges and the management challenges that you have, we're able to go in and address those. So it might be anything from front door. If it's a demand management issue, we can look at tools and techniques and processes to be able to improve that. If there's a high cost area that you really need to address and it won't be addressed by being able to just simply reduce a backlog, then we can look at that, and we can look at that financial modelling and say what will work best for your customers, as well as what will be within the confines of what you can do in your local authority.
My name is Martin Murphy and I'm Head of Children's Services here at ICS Assessments. I'm a qualified social worker and I've been qualified now for over 33 years. My role here in ICS is to ensure that we deliver safe, quality children's services to organisations across the country. ICS Assessments provide a range of children's services. For example, we have worked within assessment teams. We've created assessment teams for organisations to reduce the workload for social workers within that organisation, to add capacity to the organisation and to deal with backlogs of assessments, ensuring that we work closely with the local authority and the teams to add value and to ensure best outcomes for young people and their families. We also work within the SIN, CP and LAC populations, dealing with some very complex and difficult cases, to getting them to court, making sure that the cases are at the right level of legal intervention. We've also done some work with organisations around their LAC population, focusing on whether or not we can return young people safely back to their homes, or to be able to stay with their carers, depending on an assessment and depending on the level of support, and whether the child can return home under a discharge of a care order or under a special guardianship order to their current carers. These sorts of processes add value to the organisation, and we hope to leave the organisation in a better place than it was when we first became involved. What differentiates our service from others like it is that we have experience and quality throughout the organisation, from the top of the organisation to the social workers. We also have qualified and experienced family support workers with us. We have an extensive support network for the social workers and the teams back here in Manchester. We have a management consultant who can come in and do some work with the organisation to look at policies, processes, procedures, and see how we can improve workflow. We can work alongside you to challenge the current ways of doing things. We can offer our advice, our insights to your organisation, and we can look to work with you and your colleagues collaboratively to improve outcomes for young people and their families.
My name is Alex Sweeney, Managing Director of ICS Assessment Services. There's a common misconception in outsourced services that the quality of service is distorted by commercial considerations. That's absolutely not the case. For us, excelling in our service delivery is absolutely the highest priority.
So local authorities should consider engaging in our services because we're performance-based. So every project we do would be based around return on investment. It's really important for us that actually we can show some outcomes around the work that we do. So if we're running some process mapping exercises or looking at cost improvement, we want to be able to value that. We want to be able to put a figure on that essentially and say, this is what we think we can achieve. We're able to do that because every project that we undertake, we always do a free diagnostic exercise at the start. So we'll be able to come in, have the conversations with the key people, we'll talk to your management teams, we'll look at the kind of performance information you have, we'll look at everything that you allow us access to and be able to make a really informed judgment about what we think you can do as well working with us.
I would recommend ICS Assessment Services for the sheer fact that we, within the team, the ICS team, we have a huge amount of experience, a huge amount of knowledge, and we are driven by providing good quality services. And over time we have developed that. We've got systems in place, auditing tools to allow us to be able to improve quality. The social workers that we employ in our projects are all driven by our business motives, which is about providing good quality assessments using the strengths-based approach and getting better outcomes for people in a more creative and innovative way.